Anorexia nervosa, often simply called anorexia, is a serious and treatable eating disorder that affects people of all ages, genders, and backgrounds. While many imagine anorexia as only affecting those who appear extremely thin, the reality is more complex. Some individuals may not look underweight, yet they are still struggling with the disorder. At its core, anorexia involves an intense fear of gaining weight and a distorted body image, leading people to restrict their food intake or engage in extreme behaviors to control their weight. This condition is not a lifestyle choice or a matter of willpower. It's a mental health disorder that can have life-threatening consequences if left untreated. Anorexia can cause profound changes in the brain and body, making recovery challenging, but absolutely possible with the right support and treatment. Let's take a closer look at the symptoms and risks associated with this condition. The symptoms of anorexia nervosa are both physical and emotional, often making them difficult to spot. Physically, people may experience extreme weight loss, fatigue, dizziness, and changes in skin or hair. Some may feel cold all the time, have irregular heart rhythms, or notice swelling in their arms or legs. Emotional and behavioral signs include an intense focus on food, skipping meals, or developing rigid eating habits. Many individuals with anorexia may cook for others but avoid eating themselves, or they may only eat certain safe foods. There's often a deep fear of gaining weight, frequent body checking, and a tendency to wear layers to hide their body. Emotional changes such as irritability, withdrawal from social activities, and trouble sleeping are also common. Because anorexia can affect the brain, those suffering may not recognize the seriousness of their condition, making early intervention by loved ones and healthcare professionals crucial. The exact causes of anorexia nervosa remain unclear, but experts believe it results from a combination of genetic, psychological, and environmental factors. Genetics may play a role, especially if there is a family history of eating disorders or certain personality traits like perfectionism. Mental health factors such as anxiety or obsessive-compulsive tendencies can also increase vulnerability. Environmental influences are significant. Modern culture's emphasis on thinness, social media pressures, and experiences of bullying or criticism about weight can all contribute. Adolescents are particularly at risk due to the physical and emotional changes of puberty, as well as peer pressure. Major life transitions, such as moving to a new school or experiencing a loss, can also trigger the onset of anorexia. Understanding these risk factors is key to prevention and early support. Anorexia nervosa can lead to severe complications, affecting nearly every organ system in the body. Heart problems, bone loss, anemia, kidney issues, and hormonal imbalances are just a few of the physical risks. In some cases, the condition can be fatal even if the person does not appear underweight. Mental health complications such as depression, anxiety, and increased risk of suicide are also common. Prevention is challenging, as there is no guaranteed way to stop anorexia from developing. However, primary care professionals can play a vital role by recognizing early warning signs during routine checkups. Open conversations about body image, eating habits, and emotional well-being can make a difference. Support from family, friends, and organizations dedicated to eating disorder awareness is essential for those at risk. Early intervention and compassionate care offer the best chance for recovery and a return to health.